County Health Agency is not endorsed by the U.S. government, federal Medicare program, Social Security, or any other government agency.
County Health Agency presenting information and resources to help you apply for Medicare. Medicare is our country's health insurance program for people age 65 or older. You will sign up for Medicare Part A and Part B through Social Security. If you are under age 65, you may be eligible for Medicare. If you have permanent kidney failure, or if you receive disability benefits, Supplemental Security Income, SSI, does not qualify you for Medicare on its own. Even if you receive SSI, you must meet one of the other requirements to qualify. Information you would need to provide: basic information about yourself, like your Social Security number, where you were born, city, state, country, health information, start and end dates for any current group health plans, start and end dates for any group health plan after age 65, Part B only, a valid email address, your existing Medicare number. Sign up for Medicare. If you are 65 or older, you can enroll online for Part A and B, or Part A only. You can delay Part B if you already covered through an employer group health plan. Sign up for Part B only. If you previously declined or never signed up for Part B, you can sign up for Part B only. On the links in this video, or go directly to ssa.gov. Sign up for Part B only. Part B helps you pay for the basic healthcare services. If you already have Part A, you can add Part B during specific enrollment periods. It is important to sign up promptly to avoid gaps in coverage or late enrollment penalty. Your coverage generally begins the first day of the month after you sign up. When you are ending an employer group health plan, if you've been covered by an active employer group health plan within the last 8 months, either you or your spouse, you can enroll in a Part B without any penalty. This is considered a special enrollment period. See exactly when you can sign up. When to sign up for Medicare. Most people sign up for Part A, hospital insurance, and Part B, medical insurance, when they are first eligible, typically at age 65. It is important to sign up promptly to avoid gaps in coverage or late enrollment penalty. However, if you already covered through an employer group health plan, it might make sense to sign up for Medicare later or delay Part B. If you are age 65 or older and receive Social Security benefits, you will be automatically enrolled in Part A. The 3 enrollment periods. The first one is when you're turning 65. This is the initial enrollment period, and there are no penalties if you sign up during this time. It lasts for 7 months, starting 3 months before you turn 65 and ending 3 months after the month you turn 65. For example, a person born July 4th, 1958, they should enroll in this window to avoid a penalty. If you sign up from April 1st, 2023 to June 30th, 2023, your coverage will begin July 1st, 2023. If you sign up from July 1st, 2023 to October 31st, 2023, your coverage will begin the first month after you sign up. The second enrollment period, after 65 and you have been covered by an employer group health plan. This is a special enrollment period, and there are no penalties if you sign up or add Part B during this time if you or your spouse have health insurance through your job, and you can sign up. Anytime while working and still covered by the group health plan, within 8 months of the day you or your spouse stop working, even if your group health plan continues for a time. Within 8 months of group health plan ending while you or your spouse continues to work, your coverage begins the month after you sign up. The third enrollment period, when you miss the other periods, likely penalties involved. This is the general enrollment period, and there is typically a lifelong penalty if you sign up during this time. If you have not filed it during the other period, you can still sign up between January 1st and March 31st each year. Your coverage begins the month after you sign up. Learn about Medicare basics and enrollment periods, including plan types and eligibility at Medicare.gov. Parts of Medicare, Part A and Part B. You'll sign up for Medicare through Social Security. You can sign up for Part A/B or Part A only. Part A, hospital insurance. Part A helps pay for inpatient care at hospital, skilled nursing facility, and hospice. It also covers some outpatient home health care. Part A is free if you work it and pay Medicare taxes for at least 10 years. You may also be eligible because of your current or your former spouse work. Parts of Medicare continue. Part B, Medicare insurance. Part B help covers services from doctors and other health care providers like outpatient care, home health care, durable medical equipment, some preventive services. Most people pay a monthly premium for Part B. The exact premium depends on your income level. Parts of Medicare continue. Part C and D. Private companies run Part C and D. The federal government approves each plan. Costs and coverage types are varied by provider. Part C, called Medicare Advantage, is an alternative to Part A and B that bundles several coverage types, including Part A, B, and usually D. It may also include vision, hearing, dental insurance. You must sign up for Part A and Part B before enrolling in Medicare Advantage plan. Part D, prescription drug coverage. Part D helps cover prescription drug costs. You must sign up for Part A or Part B before enrolling in Part D.
You can choose from two paths. One, original Medicare, Part A, hospital, Part B, medical, Part D, a separate drug plan if you buy it. You can also include a supplemental insurance to help pay some of the out-of-pocket costs that come with original Medicare. The second option is Medicare Advantage, combines a Part A, hospital, Part B, medical. Most plans include a prescription drug plan. Medicare Part D, if your plan doesn't include it, you may be able to join a separate Part D plan.
Applying for Medicare? Let's talk. Together, we can find a plan that will meet your needs.
We are on LinkedIn, Facebook, YouTube, Instagram, and Twitter.